Now, why I'm telling you all these? So, of course, these are important. So, when we are providing our numbers, this is Delaware only. We do have clients, patients outside of Delaware, but from the network accountable care organization standpoint, from the clinical integration standpoint, Delaware is our home. So the total unique number of patients we serviced in the last 12 months, it's at 116,000. And then this is with about 430,000 appointments. Now, we believe this number from the population side, maybe 12%, but from actual active patients, we probably serve close to 20% of Delaware at any given point. And that's what we have done since last year. And it's nothing new, so we were doing this, but now we are able to look at these numbers very closely. So I'm gonna have Tanner to go through a couple of our standard reports, so then we have some questions and we'll have some discussions together.
Sure. Thank you, Kemal. As Kemal was mentioning, this is some information that we had since the onset of the pandemic, been wanting to regularly update our providers throughout our network with. So that's really why we wanted to go ahead and start with those regular update meetings for our providers to keep everyone in touch, connected with what's going on with our patient population throughout the pandemic. So some of the key metrics that we keep in track of are, of course, like our own percent positive rates amongst our patient population, which we have, as you can see here, seen a slight trend downward. And alongside the rates that we're looking at, we're also keeping track of the amount of tests that are ordered through the EMR for all of our providers that are actually ordering through PowerChart. We're keeping track of that as well, which is going to be represented down here on this graph bar. So we're seeing a little bit of a decline in the orders coming out of the EMR, but we have to remember that our patients aren't or may be getting tested maybe in the pharmacy setting, other types of state-run testing centers where we might not necessarily be picking them up, but we are still making sure we're trying our best to get that documented for our patients. So we are seeing a little bit along with the state, we're seeing a drop in a positive rate here with our patients, which is encouraging. It's a good sign, of course, especially as we're still in the early onset stages of getting vaccinations. So this is something else that we like to keep track of, which is really wanting to make sure our patients are getting tests completed once they are ordered. We think that that's very important to kind of understand and get a good grasp on which patients are, or tests that might be going unfulfilled. And then part of the business development regular routine is to, alongside with our practices, kind of check up on these patients, make sure that there's no hurdles or barriers for them to get tested, make sure they are getting tested, and then making sure we have that result accurately documented within the EMR. So this red bar here is signifying the percent that are positive, alongside two different other categories, which are patients that are either just not getting tested, saying they are kind of declining it, or that we can't get a hold of for a follow-up, which is concerning. So that's why we wanted to make sure we have an accurate number. And that's why the business development team, again, alongside with our practices, we're making sure we're constantly following up with these patients to make sure we have a good idea of the amount of tests that are getting filled and might not be getting filled. So here, alongside with the vaccine rollout, as we've kind of had this as a topic of discussion in events past, and something that we want to make sure that we're keeping on top of, and making sure that we're communicating this information to our patients as we're, again, in the early stages of the vaccine rollout here in Delaware, as well as across the nation. So this is actually a report coming out of the CDC earlier this week. We just kind of wanted to take a look at, based on the average daily first doses that we're looking at right now, where we might be going forward into the year. So how much of the population can we have vaccinated as we move into the next months, coming into the summer, and then looking forward towards the end of the year. So right now, the CDC is reporting about 8% of the population as of February 3rd, that's vaccinated. And you can kind of see that means we're at current pace of about 50% sometime here in the summer, 70%, which is getting into the area where we're considered to have a herd immunity. and then a 90% towards the end of the year. So this is some encouraging news, and this is something that we're going to keep an eye on as well and continue to present for our patients.